OCD is often misunderstood as just a preference for neatness or order, but it's a serious psychiatric disorder that can disrupt every aspect of a person's life. The core of OCD is a cycle of unwanted, intrusive thoughts and the urge to perform certain actions to relieve distress. Imagine your mind stuck on a terrifying thought, replaying it endlessly, no matter how hard you try to stop. OCD traps people in a loop of anxiety and repetitive behaviors, consuming hours and causing immense emotional pain. The difference between being organized and having OCD is the presence of severe distress and impairment. These thoughts and behaviors are unwanted and deeply disruptive. Using OCD lightly trivializes the real struggle millions face every day. By understanding OCD, we can help dismantle stigma and support those living with this challenging condition. OCD is defined by two parts: obsessions and compulsions. Obsessions are persistent, intrusive thoughts or urges that cause intense anxiety, like fears of contamination, harm, or a need for symmetry. These thoughts are not just worries. They feel real and threatening and can be deeply disturbing. In response, compulsions arise, repetitive behaviors or mental acts performed to reduce the anxiety. Compulsions might include excessive hand-washing, checking, counting, or arranging items in a specific way. These rituals provide only temporary relief, reinforcing the cycle and making it harder to break. People with OCD don't want to perform these actions. They feel compelled, trapped by their own minds. The cycle of obsession and compulsion is exhausting and can take over daily life. OCD isn't just about hand-washing or cleanliness. Obsessions and compulsions can involve almost any theme, from fears of harming loved ones to superstitions about numbers. Not all repetitive behaviors are OCD. The difference is that OCD rituals are driven by anxiety and are unwanted, not chosen. People with OCD are usually aware their fears are irrational, which adds to their distress. This awareness creates a painful paradox, knowing a thought is illogical but feeling powerless to stop the ritual. OCD isn't a quirk or a joke. It's a neurobiological disorder that pits rational thought against overwhelming anxiety. Dispelling myths about OCD is crucial for empathy and encouraging people to seek help. Those with OCD aren't crazy. They're fighting a difficult battle with their own minds. Understanding the truth about OCD helps reduce stigma and supports recovery. OCD is a neurobiological disorder, not a result of character or upbringing. Brain imaging shows that certain circuits, especially those involving the orbitofrontal cortex, anterior cingulate cortex, and striatum, are overactive in people with OCD. This faulty brain circuit creates a loop of false alarms, triggering obsessions and compulsions. Serotonin, a neurotransmitter that regulates mood and impulse control, is often imbalanced in OCD. Medications that increase serotonin can reduce symptoms, supporting the biological basis of the disorder. Genetics and environmental factors, like trauma, also play a role in who develops OCD. Ongoing research is helping us better understand and treat this complex condition. The good news is that OCD is treatable, often with a combination of therapy and medication. The most effective therapy is exposure and response prevention, ERP, a form of cognitive behavioral therapy. ERP helps people face their fears and resist compulsions, gradually reducing anxiety and breaking the cycle. Medications like SSRIs, which boost serotonin, can also help manage symptoms and make therapy more effective. For severe cases, advanced treatments like transcranial magnetic stimulation or deep brain stimulation may be considered. With the right support, people with OCD can regain control and lead fulfilling lives. OCD is not a life sentence. Recovery is possible. Compassion and understanding from others make a real difference in the journey to wellness.